how do you walk effectively to grow those beautiful collateral vessels, or what are known as natural bypasses, around the blocked arteries in the leg?
That is a great question, Kim. So first of all, when we have patients who claudicate, which means that it hurts when they walk, when it hurts when they walk. If this is the femoral artery, that's at the level of the middle of the thigh, if that artery is the one that has this disease, growing those collaterals requires, just as you said, walking. It is essential, but it requires, just like going to the gym, you have to do this every single day. And you don't do it because you did it for 15 minutes. Muhammad Ali, they used to ask him, "How many abs do you do?" And he would say, "Well, I don't start counting until it hurts." And we should apply the same thing when we're walking. It's not a matter of going out and walking 15, 20 minutes a day at the indoor mall that's local. It's actually walking through to where your legs ache. And then when they ache, pushing, if you can, maybe another half block or another block, and then taking a break and doing that 3 or 4 times consecutively. That will help grow those collaterals. But it's not about time. People say, "Oh, I walk 45 minutes twice a day." But you watch them walk and you're like, no, that doesn't count. You're barely walking. You're window shopping. That doesn't count.
Patients that will call us and say, but I've been walking, I don't understand. I mean, I walk 1 to 2 miles every single day. I've been doing this for 15 years. And then suddenly my legs start hurting. That doesn't make sense, that my doctor now wants me to walk. I don't get it. And the doctors are not teaching their patients exactly what you said, that it's not just about going out and just leisurely walking. It's about pushing yourself, just as you do at the gym, like you were saying, give me that one extra rep, give me that one extra rep. You're not going to grow that bicep. You're not going to get those muscles unless you push that extra rep. And that is such a great way to think about it, that when you're walking, you're not going to push it. You're not going to build those collateral vessels until you push through that pain.
Yes. Yes, absolutely.
So it's still tough, though, to convince your patients to push through that pain, isn't it?
The tricky thing is, um, some patients they develop a more sudden development of that femoral artery disease. So it's harder for them to grow collaterals because they have nothing's even possibly being built up. And that's where the possibility of adding medications could help. Now we do have medications that in theory, um, can help blood squeak its way through these smaller arteries collaterals. So we've got low dose aspirin, we have low dose Xarelto, we have the classic medicines that started in the 70s and the 80s, Fleetol and Trentol, which are the first line therapy for patients who have purely claudication. And there is pretty good evidence that the combination of these will help that patient be able to walk, hurt, and be able to walk through it. But sometimes you have to hold their hand in that process. I can't just tell them, well, go walk, but here's a walking program, a 12-week walking program, and we're going to try these medications. And if they don't work, we're going to escalate these medications. And if that doesn't work, well, then maybe we consider some type of therapy, more invasive therapy. But
What
it does require lots of handholding.